There is no cure for it, and it worsens over time. PAH affects about 200,000 people worldwide. You might hear more about it throughout November, Pulmonary Hypertension Awareness Month. A new web cartoon series will help kids better understand it. Lips Painted Blue was Sean Wyman's idea. He's a medical student and PAH patient. Also with us, Dr. Victor Tapson, a researcher and specialist in pulmonary and critical care medicine. Good morning to both of you.
Morning.
Good morning.
Doctor, what does PAH stand for, and would you describe the condition for us?
Sure. So PAH stands for Pulmonary Arterial Hypertension. And what this amounts to is high blood pressure in the lungs. So it's different than regular high blood pressure. You've got these millions of little blood vessels in the lungs, and they carry blood into the lungs to pick up oxygen. And they get thickened and narrowed in PAH, and the blood can't get through. The heart has trouble pumping this blood into the lungs, and the heart gets enlarged. You get what we call right heart failure. So patients can get very short of breath, dizzy, lightheaded, get chest pain, even pass out sometimes. It can be a very tough disease. And one of the unfortunate things about it is the disease is often diagnosed late. Patients may take a year or 2 years to get diagnosed. It's mistaken for asthma or some other lung disease, or for being overweight or deconditioned. So now, fortunately, we have a lot more we can do for it than we used to.
Sean, I'm curious about the cartoon, and we'll get there, but to the point the doctor was just making, how old were you when you were diagnosed, and how long had you been experiencing some of the symptoms without knowing it?
When I was diagnosed with pulmonary hypertension, I had probably been experiencing symptoms for about, I want to say about 6 months that I recall. I'd walk down the street and I'd get short of breath. It felt like I had an elephant tap dancing on my chest in stilettos. A couple times I had actually passed out, and my friends and family that were around me said that my lips and my fingernails turned blue and that I should probably go to the hospital. And I went to the hospital, and after about a week of rigorous testing, they finally came to the conclusion that I had pulmonary arterial hypertension. They started me on medications. They told me I probably wouldn't work or be able to go to school, which was really, really unfortunate. And after starting on the medications, I started to feel better. And now I'm a second-year medical student at Western U out here. And I'm also engaged, and I've got 2 daughters.
That's wonderful. So why did you create this series?
So I developed the cartoon series because after talking to several pediatric patients, I realized there weren't very many resources out there that explained it in a way that kids from the ages about 7 to 10, or maybe even 7 to 13, could understand the disease. So I came up with the cartoon series because at that age range, I loved cartoons. I actually still love them, but still, this helps explain everything that's going on in a way that they can understand, and even their parents can understand.
And is it intended for them if they've been diagnosed, or is this so they can better understand loved ones who have the condition?
It's primarily directed towards patients with pulmonary hypertension, so kids that are recently diagnosed. It's a good resource for them. It's also a good resource for siblings of patients that have pulmonary hypertension, or even their parents and even friends and family, just so that they can get a better idea of what's going on.
Doctor, it's encouraging to hear Sean talk about his life and all of the blessings in it. What is your message to other patients who've been diagnosed who may be feeling there's not a whole lot of hope there?
Well, I think one of the things important with this disease is that we can do a lot more than we used to be able to do. Now we have about 12 drugs that have gotten through the FDA that have helped patients. Survival's improved. We don't tell people that this disease is uniformly fatal anymore. I think we have a lot of things we can do. Strong medications, a lot of research. We're learning more and more all the time. So we've been able to make a lot of progress.
And one more question, Sean. Where can our viewers go to see the web series?
To view the series, you can go to lipspaintedblue.com.
Thank you both for joining us. We appreciate your time.
Thank you.
Thank you.
Thanks. Mike?